Hi everyone, this is Deepa with Allen Pharmacy and Wellness. We're at 945 West Stacy Road in Allen, Texas. And today, given that it's May and we're talking about mental health awareness because May is Mental Health Awareness Month, so I wanted to talk a little bit about mental health and what that means, especially during this time when everyone is kind of stuck at home, quarantining and socially distancing themselves, and it can be kind of tough on people. So and I'm also going to talk about a few things that you can be doing from home to help with your mental health if there's any issues there. So number one thing I would say is, please check in with this is a perfect time when people are not so busy. They're not, you're not running around stuck in traffic doing things. So it opens up some time to catch up with the people that you may not always catch up with or talk to or see. So, pick up that phone, check in on the people, on your friends, neighbors, especially if you know that they're living by themselves, or that they might need some help, or just reach out to them and see how they're doing, how get a mental health check with them and see if they need anything, if there's anything they can do. Sometimes just speaking to somebody for 5 minutes can really help people take that load off. So that's just something that everyone can pretty easily do. Just check in on one or two people at least once or twice a week, and that way it just helps us be a stronger community. Another thing I would say is, if you seem that you have people that, this is such a silent killer, mental health issues. So just because someone is always happy or cheerful, don't just assume that those people have it all together. It's okay for them to kind of also have someone ask them that, hey, I know you look like you have it all together, but are you doing okay? Is there anything I can do for you? I feel completely blessed that I have a lot of people in my life that do that for me, and I try to reciprocate and pay that forward. But, I think that every little bit helps. And even if you have it all together, sometimes it feels nice to just have someone ask you for a change how you're doing. So let's come together. This is the time for us to come together as communities and help each other out, and help our elderly folks, and help our patients and friends and neighbors that might be living by themselves. We have a lot of single moms. They might be struggling. It just helps to get that out in the open and just kind of talk about it. Another thing I've noticed in the recent weeks is a strikingly higher number of, or drastic change and increase in the number of antidepressant prescriptions and anti-anxiety medications that we're filling these days. And I just want to say that that's okay. It takes a lot to recognize that you need help, and then to admit it, and then to actually go and see a doctor. So it takes a lot. So take a moment to commend yourself for taking that step to do what was necessary to help you get better. That's all that there is to it. There is no reason for any extra, thought in there, or to feel bad about it, or there's no reason for labels. And it doesn't mean that just because you needed some help now that it's a forever thing. It's okay to understand that that's what you need, and it's okay to take the steps to help you feel better so that you can take care of everyone else that might be around you. So I wanted to just say that out there, because I know we had some patients that were just embarrassed, or were afraid of the stigma, or they felt that they had somehow not met some kind of expectation. And I know that we put so many things on ourselves that sometimes if we feel that we needed some help, that we're embarrassed about that, or but don't. It takes a lot of guts to say that, no, I need help, that's my limit, and that's amazing. So thank you for doing that for yourself. And if you need to pick up the phone and call anyone, then I'm always here. I'm always a free therapist for my patients and for friends and whoever else calls. So don't be afraid of that. Another thing I was going to say is, if you have time, you can always do a little yoga routine. There's so many YouTube videos these days. But if you're local, and I have a really good friend, Sarah Shiplet. Hi. She's just an amazing yoga teacher, and I follow her and work with her, and she's helping me with my yoga practice. and just helps with some meditation and things like that, to just kind of take that deep breath, and to kind of be in the moment instead of worrying and stressing about all the things that we have to do before and after. So I'll post a link in the comments so you can check it out for yourself. I know you won't be disappointed. And another thing I was going to say, like, if you're on the brink, you don't know if you need help, if you're trying to figure out if you need to be on an antidepressant, or if you need some help with anxiety, what else options are there? So I wanted to really talk about CBD oils today, because that is, it's on the rise. Like, pretty much every corner has a CBD store these days, and I always get patients that ask me, like, how do you know what to use? And there are so many, and how do we know if that's a good quality? And there were just a lot of ambiguity surrounding that. So I thought I'd take some time today and talk about that. We carry a brand of CBD oils here that it's called Embark, and I'll bring it closer so people can see it. I've actually looked through about 32 different companies and different brands before I chose Embark, and that was because of a few different things. So the few questions that I would ask before you select a CBD brand or company to use for yourself would be to see if it's oil-based or if it's water-based. I love an oil-based product, especially because it can go pretty much in a lot of places in our body. So the one that's by Embark, it's actually the carrier oil is MCT oil and coconut oil. So what that does is it actually crosses the blood-brain barrier, so it helps to take the medication up into the brain. Not a lot of medications have the capability to cross the blood-brain barrier. So if you're going to be using it for depression or anxiety or panic attacks or PTSD or any of those, or sleep or those issues, then you want it to be able to cross the blood-brain barrier. So that really helps with that. Another reason I picked Embark was because they actually send me the certificate of analysis on each batch that they do, and they get of the compound, so that I know that if somebody were to get randomly drug tested at work or something, then they're not going to be finding a detectable amount and lose their job over something. And that was very, very important, because we have a lot of patients that come to us that are in the fire department, in the police department, and they might be getting they get a lot of randomly drug tests done, and they don't want to be losing their jobs. And we also don't want to be sending even though you're taking a small amount and you're taking a spray of it or 2 sprays of it, over time it can become detectable in your bloodstream. So it was very important to us that we picked a product that would not show up on tests that or affect their ability to work while they're at work. So we wanted to make sure that we picked a really good and safe product for that reason. Also, another thing is I'm not a very big fan of like all the tablets and things that might have CBD gummies, and that's because once it goes through your digestive tract, because once you eat something, it's going through your digestive tract, and then a lot of it may not even get absorbed, so you may not get the full benefit of it. I love the oil-based one because you just take a few sprays under your tongue, wait about 30 seconds, it gets absorbed directly into your bloodstream, so you get a good 96-98% absorption rate there. And that so you get your full money's worth there, because let's face it, these things are not always the cheapest things on the market, and I want to make sure we bring the best value for our patients. Also, not necessarily, it doesn't really need to, when it doesn't have to have like all these different flavors. I wasn't sure, like I'm just throwing this out there, so I don't mean any offense to anybody else's product or anything like that, but when I see something that has CBD oil with rosemary, or CBD oil with lavender, and what does that mean, right? So it doesn't mean that one thing helps with digestion and the other thing helps you sleep, although that's how a lot of things are marketed to us, but that just means that that's the flavor that they added to it, and all, in my opinion, all that does is dilutes out the actual CBD content in it. So now I'm getting a whole bunch of rosemary and lavender, which I can just purchase probably an essential oil for, and use it separately, you know. But CBD in itself already helps with all those you know, conditions. It helps with digestion, it helps with the sleep. So you don't need to have one that has all these different flavors to buy one for one thing and the second thing for something else. So just to kind of give you an idea of the things that CBD oils can help you with, I have a little pamphlet, so I'm just kind of gonna read it from here. But for pain, anxiety, depression, trouble sleeping, epilepsy, arthritis, neuropathy, nerve pain, fibromyalgia, PTSD, memory loss, early onset dementia, multiple sclerosis, Parkinson's, migraines, you know, oncology patient pain support, nausea, inflammatory bowel diseases, rosacea. It's used as an antifungal and also for as a sunburn cream. So these are all the things that CBD can inherently help you with. It has those properties already, so it doesn't necessarily have to have any other flavors or anything else added to it. And then there's also a cream that can be applied topically, specifically to the area of pain. And if you need something for overall inflammation, then the oil is the best option for that. And then we also have some gummies, although these have melatonin, so it does help that it has, it does help that it goes through the digestive system and then you absorb the melatonin, and so it does help, and you only take about a quarter of the gummy. Although they taste so good that it's sometimes easier to eat the whole thing, but I didn't say that, and neither should you do that. But just wanted to give you an idea of the taste there. Another thing, the last thing I would say is, you know, please don't use these products just without checking with your doctor, with your pharmacist, and make sure that they know that you're on them, because they're not always necessarily without any side effects. Although you are taking it, it's homeopathic, you'll have the chances of side effects and drug interactions with other meds is very low compared to some of the other medications that you can actually be on, but that doesn't mean that it doesn't have any side effects or any drug interactions. There are some you know, classes of medications that it does interfere with, and so for that reason you should at least discuss it with your pharmacist, or call me. I'm happy to help you figure out if you're on those medications or not, where it can be a drug interaction with those. And the best thing to do would just to pretty much separate it by a few hours if you are on those medications. But it is important for you to know that, and the patient that knows more about what they're taking and how they're taking is, of course, having that knowledge can make all the difference. But that's all that I have for you guys today. I hope everyone has a wonderful Friday and a wonderful weekend. And if there are any questions, I'm always here to help as usual. Oh, and one of the things I completely forgot to mention is that we are now ready and are able to ship any of these CBD products all over our country. So if you live in other states, and if you've been our friends, family, and you've been watching us and liking us, and, you know, wondering if there's any way for you to support us, then, you know, we do have these products and we can ship those all over the country. So now there's a way that you can support us. And thank you for watching and for liking and subscribing to our videos. And if there's any questions, please don't hesitate to reach out. Thank you. Bye.